Welcome, everyone, to another episode of Dictations. As always, I'm with Performance Medicine's founder and medical director, Dr. Tom Rogers. Dr. Rogers, how you doing today?
Hey, Ben. Good. How you doing?
We were talking before about what we wanted to talk about today, and with the debates that have been going on, a lot has been talked about around healthcare. Why don't you just give our listeners some of your thoughts on where things are with Medicare and things that have been talked about quite a bit?
Well, as you know, we watched the Democratic presidential debates last night, and the focus was really on health care. That was a major controversy. I think it will probably decide the next election and the direction the country's headed in with health care. I don't mean to kind of go off on the health care system, Republicans, Democrats, it doesn't matter, but somebody that's practiced medicine for 35 years. I grew up in a medical family. My dad was a physician, and of course he talked about socialized medicine with me back in the 60s. I can remember him talking about how he thought it should be fee-for-service, and he was always against socialized medicine. So I've kind of grown up with doctors and along that paradigm, but it's really interesting what's happened to medicine over the last 40 years or so that I've observed it as either a medical student, resident, or practitioner. And, what I think really is that we're not getting to the root of the problem. Kind of like in a lot of ways that medicine just placates people with medicines and doesn't really solve the whole problem. And so you had people like Bernie Sanders advocating Medicare for all, and that's the progressive wing. And of course, the more conservative people do not want free health care, as you term it, but I certainly think most people are for, everybody getting decent medical care. The problem with Medicare for all are many, and in my opinion, it's not really a good solution, because when I heard Bernie Sanders interviewed after the debates, they were asking him about how that would work, and he says everybody gets free care. Whether you walk into the country as an illegal immigrant, whatever, you're going to get free medical care. The same as people that pay taxes or pay for insurance, which they wouldn't anymore. Everybody's covered. He said there'll be no deductibles, no co-pays. Everybody gets free medical care. If you have any bit of sense at all, that won't work, because number one, you can't pay for it. As a physician that's practiced for so many years, you can't just open up the floodgates for anybody to get. It'd be like giving free candy to every kid in the world. It'd be a total debacle. There's got to be some kind of...
I'm assuming that it would be subsidized through the government, right?
Right.
And
there'd be no insurance companies, and everything would be free. The people that have paid into Medicare all their lives, so what? Everybody gets Medicare now. And kind of like the same deal with free college. Everybody gets free college. What about the people who have paid for it and they're paying back debts and they've earned it? Now it's free. It's not worth anything. The same thing would happen with medicine. It would really cheapen it. Nobody would want to be a doctor or a nurse, because it'd be too frustrating to try to treat everybody for free. It'd be poor care. It'd be terrible care.
I think that's because initially I'm thinking, it makes sense in that it would be nice if everyone had access to free health care. The problem is you're right, it'd be a supply and demand issue. You wouldn't have enough people going into the healthcare field to be able to see everybody that's going to be, flooding the hospitals, and I guess there wouldn't be private practices, but all the medical practices.
Right. I mean, it would turn doctors, nurses, technicians into government workers, and government workers generally are going to work a set amount of hours. They don't have any incentive to, do any better than anybody else, so the care would be much less quality. You wouldn't get people wanting to go into medicine that were really have a passion for it, because they wouldn't get commensurate pay, and it'd just be too frustrating.
Well, and you're not a politician, and I'm not a politician, but how would you go about this if we could have our cake and eat it too? Where there's more access to healthcare, but also there's a marketplace. Because with a marketplace and with competition, it breeds higher quality. So how do you think? How would you kind of manage that?
Well, I mean, I agree that there are problems with insurance companies and pharmaceutical companies. I mean, the medicines are too expensive. There's no visibility in medicine right now with the way they do it. That's kind of why I practice the way I do. It's all fee for service. It's all cash. It's all up front. You know what you're paying for, what you're getting. There's not a code to look up for an insurance company. There's no incentive for me to use $1 million medicines and that type thing. So there are problems with the industry. There's no doubt. But personally, I've never seen anybody go into the emergency room and not get treated. I mean, you can't turn somebody away from the emergency room. So I've never seen that kind of thing. And I've worked emergency rooms. Somebody goes in there sick, they're going to be treated. They may have to wait a long time. Can you imagine the wait if everything's for free?
No.
I mean, no copay. I mean, you can go in for anything. The lines or queues, as they'd say, would be so long, and the people would demand everything. It would just be a total, I don't want to say it on the podcast, but it would be total disaster. And that's not what our country's based on. We're based on capitalism and free enterprise and, kind of pay for what you get. Now, for people that are indigent or that, they have programs that work fairly well. And a lot of them, of course, take advantage of it. But it just won't work. Everybody knows that.
Yeah, and I think that's the thing right there. Is it seems a little too idealistic. Obviously, we want things to be affordable, and these pharmaceutical companies 300xing their cost on some of these medications. The EpiPen was right. Under a lot of scrutiny.
We did a podcast on that, but
yeah,
I do think costs are out of hand, and a lot of it has to do with the legal system. Doctors practicing defensive medicine because of malpractice and expectations, and the whole point of doing this podcast is really to not get into an argument about our democracy and government interference and all that, and healthcare, the pitfalls of insurance, which I personally believe insurance is for catastrophic events, not everyday healthcare. But you do have to have some pooling and coverage so people can afford some of the unreasonable costs nowadays. I've told you about Andy's appendectomy, how much that cost when he lived
right.
in Los Angeles, $204,000 for an appendectomy. Of course, the bill was settled with the insurance companies for $24,000, but the cost and the charges have nothing to do with reality, and it's for the average person, even for anybody, it's hard to figure out.
No, it's a total game.
So it needs to change for sure, but there's a lot simpler ways to do that than Medicare for all. But because the free enterprise system does work. But the whole point of what I want to talk about today is the root of the problem. The root of the problem is that we require too much health care in this country. I mean, we have the most technologically sophisticated healthcare system in the world. We can do amazing things to treat diseases, perform operations, cure cancer, treat diabetes. We can do all this great stuff. But we still rank 33 on mortality list, and our lifespans for the last 2 years are getting shorter. So the problem is not technology or advancements. We have wonderful medicines to treat a lot of conditions, but the problem is with the people themselves. They don't know how to be healthy. And, we've got an obese society. 2/3 of Americans are obese, and most of the disease follows obesity. Too many people smoke. There's too much stress. People are committing suicide. They're taking drugs. They're overdosing at a rate that's higher than car accidents. our young kids are committing suicide. They're biased by social media. They're bombarded with all this stress. So we live in a very stressful, unhealthy environment here in the United States. We're a rich country. We have the resources for, in my opinion, for everybody to get healthy. But we've kind of been preaching the wrong things to people. And as a doctor, I try to teach people or coach people into how to taking care of themselves, so they'll really never have to utilize the healthcare system much anyway. Of course, if their appendix ruptures, they get their appendix out.
Right.
If they have a gallbladder, if they have a brain tumor, if they have diabetes, you can treat it mostly with diet. But there needs to be a new order in the way we do things, from the way we exercise to what we eat to how we sleep, to the supplements that we take. People are, even vitamin D. I mean, I've heard it said that if every American would just take 5,000 units of vitamin D, there'd be no healthcare crisis. That may be stretching it, but there's a lot of stuff we can do to not have to go into the emergency room and get our primary care.
And one quick note, because I know we got to get off here, but I think that's exactly right, because it seems that the emergency type situations the United States is really good at. We're really good at when we have to go to the emergency room and get something done fast. What we're not good at is really the primary care setting, where it's the whole staying healthy part. But when bad things happen, when catastrophic events happen, when you actually do need to utilize the healthcare system, I think the United States is pretty darn good. Does that sound right to you?
Yeah, if you're in an accident, you have trauma, you've got a weird disease, then it's a great place to be. It's not a great place to be when you're seeking advice on how to stay healthy, because it's a sick care health system. It's not a well care health system. One of the Democratic candidates that I watch on the debates, it's the one on the far left. She's an author, and she's not a politician at all. She's the only one that kind of makes sense to me, because she keeps saying we're not getting to the problem. The problem is people are fat, they don't eat the right kind of foods, and are not taking care of themselves. She's exactly right. I mean, she doesn't have a chance in hell of winning anything, but at least she's up there making kind of a point with all the other people. The moderators, they ignore her entirely, and she gets maybe 15 seconds. She always says the same thing, and so I'm glad she's up there. But it's just really interesting what's happening right now with both parties. I try not to be political. I'll never run for office, but the only thing I do is try to be a good doctor in person and try to take care of these patients.
Well, and again, we're going to get off here soon, but my thing is, we need to set up systems so that doctors can be good doctors. And I think that's kind of what we're about at Performance Medicine, is setting up an environment where a doctor, whether he or she feels like they can do good work.
Right. We're coaches for individuals that want to get personalized health care and learn how to be healthy, not treat the sickness. Prevention.
Well, we need to get off here. Dr. Raj, I really appreciate your time this week.
Thanks, Ben.
See you guys.